Hello everyone, welcome back to the YouTube channel, and today's topic of discussion is how to take a history of diarrhea. When a patient comes with diarrhea, you have multiple options that are needed to be asked, but every question will give you a hint about diagnosis, right? So the basic questions, the basic structure is: when did it start, how did it start, what you were doing when it started. Any symptom will be comprised of these three questions. When did it start? It will give you acute, a chronic scenario, as I discussed in the previous video. How did it start? I mean, he will tell you that doctor, I was drinking alcohol. I drank 20 alcohol last in the party last night, and I had food outside. I ate oysters, fish. So you will get to know an idea about the how diarrhea started. It can be gastroenteritis because you ate food outside or anything like that. What you were doing when it started. It will tell you particularly about, this question will give you particularly about hint about how diarrhea started, because if a person knows that what you were doing when it started, it means that it was very painful and a very rememberable event, right? So he will tell you this. Did you feel abdominal cramps or not? With diarrhea, most of the time you feel abdominal cramping. If not, then you can exclude some of the diagnosis. How many episodes per day? That's very important, because as I already mentioned, that in the vomiting and in the diarrhea, all the water and watery content is lost from the body. You feel dehydrated, and it's very important to ask episodes per day. Any blood or mucus in the diarrhea, any factor that worsens it. These are relieving and worsening factors, aggravating factors, because this will help you a lot in reaching the diagnosis, right? On the next is dehydration and fluid intake status. That, as I mentioned already above, that diarrhea and vomiting are severely linked to dehydration and fluid intake status. So it's important to ask these two questions in the history of diarrhea or vomiting. Next is the consistency or odor. These are important. For example, if the patient says that he has a travel hiking history, and consistency is watery and is very foul smelling, so the ultimate diagnosis will be giardiasis. Similarly, if a patient says that he has blood in the stools, extreme 11 to 12 episodes per day, and it's about 2 to 3 days it started, so you will choose the acute case, and it may be due to amoebic dysentery or any dysentery. It will be lead to a gastroenteritis that led to the blood